Antimicrobial resistance, or AMR, is a major public health threat globally, resulting in over 10,000 deaths annually in South Africa since 1990. The World Health Organization recommends a One Health approach, which recognizes the interconnectedness of human health, animal health, and the environment. This video highlights how the environmental health team in Xhariep District, located within the Free State Province, adopted the One Health approach to tackle AMR.
Antimicrobial resistance is a threat to global public health. In 2019, the World Health Organization found that at least 1.2 million people died as a result of antimicrobial resistance. Antimicrobial resistance is when people use medication, particularly antibiotics, and they don't use the full course of antibiotics either, or you have an overuse of antibiotics in animals, or you would find that pharmaceuticals end up in places where it shouldn't be. In this instance, because I'm from the environment sector, I have a particular interest in how we protect the environment. So that is the problem we've identified, that patients sometimes unknowingly flush medication down their toilets and as a result pollute the environment. And when they pollute the environment, pharmaceuticals end up right back in various dams and streams and right back in their bodies again.
On a daily basis, our community of workers go door to door to their respective households, whereby they do community education, encouraging our patients to do patient tests, and also encourage those who are on insulin to retain their shelf containers whenever they are full.
We also have to make sure that we give them the education to return unused medication, particularly sometimes when the medication didn't work.
We are given platforms such as the morning talks when we come to the facilities. We have platforms such as I do clinic open days whereby we do inform the community about our services.
We train community health workers to make sure that they understand what antimicrobial resistance is about. We also have to empower them with knowledge in terms of how they educate patients to return expired medication or unused medication. We also had to make sure that we provide them with resources to bring back the medication by making sure that the pharmaceutical waste containers in which they are able to return the pharmaceutical waste. We also have to make sure that our pharmacies are equipped with buckets for them to make sure that once the pharmaceutical waste comes back from patients, it can carefully be stored in a secure environment, locked, and once it's removed centrally from the clinic to where it is being disposed of, all of that happens as a result of us having made available resources to facilitate the process of pharmaceutical waste disposal.
We allow patients to bring medication back safely, confidently, so we have the green buckets that we put outside the pharmacy so that they don't feel like judged why they bring the medication back. There are those patients that are coming straight to the pharmacy, giving the bags, whatever they return to the pharmacist assistants, so that we can put them in those green buckets that are labeled.
Okay. They explain this pay now. Wow,
So when we started here in the community, they didn't understand that you don't keep medication that expired. You have to finish your antibiotics. We started with people really didn't understand the way of doing. So we're teaching the people to finish the medication. If something is left over, bring it back. If something like pain tablets, you don't drink it every day, don't let it expire, bring it back. We teach them to finish your antibiotics, the course that you get to prevent resistance. We explain to them that next time it's not going to work. And we also ask them that if the medication changed, bring back the other ones. If somebody passed away, bring back the excess medication. So the patients really responded well to that because they started to understand the danger of old or expired medication in the houses for children and for somebody maybe taking something that is not for them. That was the other challenge we found, is people sharing medication. So I don't finish my antibiotics, next time you are sick, I just want to give you some of mine. But really it doesn't happen a lot anymore. The patients are very supportive, if I can say. They support us in teaching them.
Nyana olsizo abantu ukuthi nabo balifumane le ndilifumanayo. and andikwazi ukuhamba mna ndizihambela ngeekroko. Kodwa nabo uThixo baphila amandla ukuthi baze kum bazondinika into zam xa ndizifunayo. Ndithuma nje umntana aze nazo izinto, ndithuma umntana ndithi baxelele njena bayeza.
Ke hore ba sa bame le hore ba na le tse tsa hore ba hlabe mo di-injection kgona rata di-sharp container tse le hore di sebeditse tse tletseng le ho ba ruta hore ba kgone ho di tlhaba hantle le hore ba tsebe hore na ba itlhabela ka mahlakoreng a feng le hore hona moo ba kgone hore dipidisi tsa bona kapa tsona di-sharp container ba kgone ho di beha safe on a cooler places.
Umsebenzi wethu ukuthi sifundise i-patient ngokuthi akufunekanga basele i-medication e-expire-leyo nokuthi i-medication xa expire bangalahleli ngasemva kwesithoyilet ukuze abantwana bangayifumani.
We are protecting the public as much as we can. So through community health workers led education, the patients are now more aware of the AMR. They are now able to return their unused and expired medication without harming the environment.
By integrating environmental health into the district's pharmaceutical and therapeutics committee, the team has ensured a coordinated One Health approach to AMR, a model that can be scaled up in other districts to protect both public health and the environment.
The overall impact of this program is like we've made great strides as a district. For an example, through the redistribution program, we were able to save the district 3.1 billion rand. And then through the education initiatives that we've done with communities, we were able to educate about 17,000 patients on antimicrobial resistance. And then through the returns of unused medication or expired medication, we were able to save the environment almost 700 kilograms of pharmaceuticals that could have been dumped on a landfill site or could have been dumped on an illegal dumping site or flushed down a toilet for that matter. So we were able to protect the environment from the effects of pollution and illegal disposal of pharmaceuticals. So in that way, I think we've made great strides as a program and we continue to make great strides as a district.